Dr. Professor U.P. Singh, a leading surgeon of Bihar, is known as best anatomist ever produced by DMCH or any college. He corrected Gray's anatomy at more than 20 places while he was a first year student. The then editor of Gray's Anatomy, Dr. Professor D.V. Davis, offered him a job of demonstrator in St. Thomas School of Medicine, London, at that very time after graduation. Though Dr. U.P. Singh declined that post of anatomist, but his lectures on anatomy is being recorded and produced for students of various faculties, as anatomy is the basis of medical science.
The spinal cord is a thumb-like structure which extends from the foramen magnum to the upper border of lumbar 2 or the lower border of lumbar 1. This is 45 centimeter in length and it has got two bulges. One is cervical bulge, another is lumbar bulge. Then it ends. The lower portion is called conus medullaris. And there are nerves going like this. This portion is called cauda equina. Now it is a structure which is housed in a bony canal made of 33 vertebrae, and it gives rise to 31 pair of nerves. It has got three coverings: pia mater, which is surrounding it, then arachnoid matter, which is away from it, and dura mater, which is tough and is attached to the or near the vertebral canal. Of course, there is a gap between the two where the vertebral plexus of veins lie. The lowermost portion of the pia mater goes like this and ends at the coccyx level. This is called phylum terminale. Phylum terminale. Though this ends, the cauda equina ends at the upper border of lumbar 1 or the lower border of the lumbar 2, but the arachnoid matter goes right up to the lower border of the sacral 2 or upper border of sacral 3, at times up to the sacral 4. This is called lumbar cistern, and through it we puncture and we take out fluid to know about the condition of CSF is examined. For examination of CSF, we remove by LT lumbar puncture between number 2 and 3 so that the central nervous system will not be damaged. We also talked that if you cut, then you find that the spinal cord is like this. Anteriorly there is a fissure, posteriorly there is a septum, in the central there is a canal, and then grey matter is here, which is aseptic butterfly type, containing anterior horn cells, posterior horn cells, and lateral horn cells. This contains CSF. Upward it is communicating with the foot ventricle. Downward it ends at the lower level, that is called terminal ventricle. We shall talk about it in the circulation of CSF. And then there are important tracts. Posteriorly we have got fasciculus gracilis and fasciculus cuneatus. These two tracts are there. Then on the lateral side we have got spinocerebellar tract, anterior and the lateral. Then we have got the spinothalamic tract, lateral and the anterior. Then on the anterior side we have got the undescended portion of the pyramidal tract. On the lateral side we have got the pyramidal tract, cross portion of the pyramidal tract, and some small tracts are there, descending fibers extrapyramidal, they are rubrospinal, reticulospinal, or olivospinal, these tracts are situated over here. So this much we had talked. Then we had two pairs of the artery. On the anterior side we have got one artery, on the posterior side we have got the two arteries. They are given by the posterior inferior cerebellar artery or from the vertebral artery. And they are assisted by the segmental vessels. It is surrounded by vertebral column, vertebral body in the front and vertebral arch, which is made of pedicle, transverse process, laminae and spinous process behind. Now, what are the diseases which can affect it? This is the most important thing, that what are the diseases which can affect it? First is congenital disease. But to know about the congenital disease, you should know about the formation of the spinal cord as well. Now, first thing is, at the time of development, from the primitive state, we get notochord. Notochord, from here, the totipotent cells that give rise to mesoderm. Above it lies ectoderm. Above it lies ectoderm. Now this ectoderm, which extends from the coccyx to the upper portion of the brain, up to the calvarium, becomes thick in the midline, in front of the notochord. This is called neural plate. Neural plate. This is ectodermal thickness, but this differentiates into the nervous tissue. Then it folds. Now when it is folding, the neural ectoderm, when it is folding like this, the terminal ends, they are having different type of cells. They separate. They come to by the side of the neural tube, and the two neural tubes meet together in this way. And the skin ectoderm from here, they fuse in the front of it. So skin ectoderm fuses with the skin ectoderm, neural ectoderm fuses with the neural ectoderm, and by the side of it lie neural crest cells. These neural crest cells are going to give rise Schwann cells, melanin cells, which are going to give pigments in your skin, or the myelin sheath, the sympathetic chain, parasympathetic chain, all the ganglion of the cranial nerves, or all the ganglions of the dorsal root ganglion, then argentine cells, then they are also going to form the adrenal medulla. So all the sympathetic and the parasympathetic cell tissue, they take origin from these neural crest cells. When this thing fuses, the notochord which was lying here, the notochord, it is surrounded by mesodermal tissue. This is going to form vertebral body, and this forms the nucleus pulposus of the vertebral column. And spine, this arch extends like this, and it meets in the midline. So neural arch is formed, which is going to protect, it is going to form the pedicle, the transverse process, lamina, and the spinous process. And in between the two muscles are going to be intercoiled. So skin is here, the bony canal is here, neural tissue is going to form the spinal cord, and vertebral column is here. This is how things happen normally. But such a complex system can go abnormal. So what abnormalities can be? The first and the most common abnormality will be that these two arches may not fuse. So if these two arches will not fuse, then what will happen? That skin is in continuity or in contact with the meninges. The bony deficiency is there. This is called spina bifida. spina bifida means spine has not united. Most of the people many of us may have it, and it will not give any symptom. But sometimes you find that there is some signs as well, and signs are that in the lumbar region there is a depression. When you feel it, you find that there is a depression or give way. Then you find that there is a collection of some fatty tissue. There may be a tuft of hair over there, or sometimes thickening of skin may be there. So these things may be found on the, that may give you an indication that there is a thing like spina bifida. Or in X-ray you can see that the two bony arches have not fused together. So this is spina bifida occulta, which is not giving any symptom. But sometimes it gives symptoms. How it gives symptoms? That at the time of birth, the spinal cord occupies, or before birth, whole of the vertebral column. Then what happens? That I told you that secondary curves develop. When baby learns how to hold his head, then what happens? That cervical curve develops. When baby learns how to hold himself, the lumbar curve develops. And this outgrows, vertebral column outgrows the spinal cord. ये जल्दी से बढ़ जाता है इसके कंपैरिजन में. So it falls short of it. ये जो कि पहले end तक था up to the coccyx, now it is ending at the lower border of lumbar 1 or upper border of lumbar 2 vertebrae. So there is a gap of it, and this the nerve becomes, because it has been pulled up, so nerve becomes like this, because they are going to be out from their respective foramina. So they become oblique. This is called cauda equina, and phylum terminal is there. Now sometimes what happens, that there is a membrane along with the phylum terminal. There is a thick membrane which is attached at the coccyx. This is called membrana reunion. Membrana reunion. Now what is the importance of it? When the cord is being pulled up, because vertebral column is growing, then this cord will put traction, this membrane will put traction on this. So the baby who was born normal, the baby who was born with no problem, starts having the problem in the leg, starts having problem with the movement. Then you find that there is a difficulty in the continence of the holding of the urine and bowel. And very soon when baby starts talking, you can find that there is loss of sensation, or as such also. By pinching you can see. So if you have got a suspicion of this thing, get an MRI done and cut it. Everything will become normal. So spina bifida occulta or spina bifida with membrana reunion may give symptoms. The second congenital anomaly may be that here everything was normal. Skin was normal, muscle was normal, this thing, meninges was also normal, only the arches were deficient. But sometimes this protrudes like this, meningeal protrudes like this. Then it is called meningocele. Meningocele. Sometimes there may be deficiency of the skin. Then we are always in hurry to operate it before it ruptures. Because if it ruptures, then meningitis will take place. Now mind it, 80% of the diseases, meningocele or other diseases which we will talk, are associated with hydrocephalus. So sometimes, mostly we love to operate first on the hydrocephalus so that the meningocele will become small. 80% of them, they have got hydrocephalus. So either you operate before or after operating on the meningocele, you can follow it up. Later on hydrocephalus will develop and we operate upon hydrocephalus. So meningocele when meninges are put together. Meningomyelocele when not only meninges but the spinal cord is also protruding, nervous tissue is also there, then it is called meningomyelocele. And not only nervous tissue is protruding in it, but the spinal canal, central canal, that also gets distended. Then it is called syringomyelocele. So congenital anomaly may be spina bifida occulta, spina bifida with the membranary union, then meningocele, meningomyelocele, syringomyelocele. So these are the cervical anomalies or the diseases of the spinal cord. Then the disease starts with the vertebral column, because the vertebral column, the disease of vertebral column is going to affect the cord as well. And the commonest disease which we get is the trauma. I always tell my students that the day will come that only 3 surgeries will remain: trauma surgery, transplant surgery, and tumor. And the rest of the things will disappear. So trauma, faster is the life, more chances you are to get a trauma. And when trauma will take place, what will happen? That all 33 vertebrae which we have enumerated, they can get injured. Now these 33 vertebrae, the first is the atlas, second is the axis, which has got a odontoid process like this, and then we have got typical vertebrae. Of course, every vertebrae differs from other, but I will call it typical because all of them has got a body, has got a pedicle, has got a transverse process, long or short, bifid or with foramen or no foramen. Then they have got laminae and spinous process. So then I will call them typical. Now fracture, trauma. Trauma can injure in 2 ways. One way is in the spinal, in the cervical region. In the cervical region, the articular processes, they are not interlocking with each other. If you go and see a vertebral column, which is lying in your anatomy museum, you will find that these vertebrae, they are locked like this with the articular processes. But in the cervical region, they are just sitting on each other. So you can get a whiplash injury.